Hi, this is Andrew, and I just wanted to give everyone some feedback on what I thought was really an excellent example of a basic care plan. So you can see here, the student here chose two nursing diagnoses, and they are very excellent choices, and they are worded in just the right format. Acute pain related to the tissue and bone injury, so we have the related to here. And um, we have as evidenced by, and then we have a very nice rationale explaining why the student chose this diagnosis and why it was a priority. Okay, and the second diagnosis also was a very good choice. The patient that we had here in the case scenario, clearly imbalanced nutrition was a significant issue, and it was a very good choice. And again, we have it's nicely stated with the related to, and he also has it as evidenced by, and he has a nice rationale as well. Not quite as good as the last one, but it's very good. Now, with the outcomes, I really like this first outcome here. He said for the outcome, patient will report a pain level of 5 or less on a 0 to 10 scale by the end of the nursing shift. Now, this really kind of goes by the SMART algorithm, which means that the outcome should be specific, measurable, attainable, and realistically time-bound. So, we have something that is specific and measurable. It's going to be 5 or less on a 0 to 10 scale. And this is something that's attainable. We all can agree that the patient can realistically attain a pain score of less than 5. Now, he has a score of less than of 8 right now. Now, I made a comment here that I generally like to get my patients down to less than 2 when possible, though that's not always possible. Now, he also had a specific time, and it's a realistic time by the end of the nursing shift. Okay, so that's exactly what I'm looking for in the outcomes, and that's a perfect example of what we mean by the SMART algorithm. Okay, now he goes on to write some excellent interventions as well, and again, they are targeted nicely to the outcomes. So this intervention, for example, is exactly targeted towards meeting this outcome, and again, it's very specific, and I know exactly what he means to do, and I can see exactly how it's going to address that outcome. The scientific rationale, nicely stated, very well related to the interventions and the outcomes. Okay, and so I just wanted to demonstrate that this is a very good quality basic care plan, and this is really the kinds of things that I'm looking for in a basic nursing care plan. So great job.